I'm interviewing my mom, who is a vascular surgeon at the MGH. So, would you say that the hospitals or the MGH was underprepared for the coronavirus?
So that is exactly the opposite. MGH is federally sponsored to be one of the 10 institutions in the country that responds to pandemics. That means that they have epidemiologists, infectious disease physicians who specialize in infection and patterns, and their goal is to be prepared for these events. So we were actually getting emails when the first outbreak occurred in Wuhan, in China, and this was in December. And
Okay.
every week, they kept us updated until it actually was more of a realistic threat, in the Massachusetts area and in the country. And I would have to say that began more in mid-February, where we were getting daily emails about sort of our preparedness strategy. And then in March, early March, the institution has actually a pandemic or acute response team. And this response team has been activated before. They were activated when the Boston Marathon tragedy occurred, when so many people were injured and lost their lives and limb. So there is a level of preparedness in the institution, and this infectious response was part of that, although they're sponsored to do so. So what we had to do is then strategize and take a look at all the people that we take care of in vascular surgery and in surgery in general, and then triage. So decide what patients needed to be treated more urgently than others in terms of their surgical needs. So cancer patients, patients who had risk of losing life or limb, those patients we continued to operate on as the overall surgical department took a step back and stopped doing elective procedures, seeing patients electively to minimize the traffic in the hospital. I knew it was a real thing when the Monday before Dexter closed, there were paramedics and ambulances out in the front entrance and all the entrances to Mass General, and it was barricaded, so they were preventing people from being able to come in, and they dedicated an entire building to just do COVID testing for people who were coming in with symptoms. And so I would have to say that I'm new to this institution, but I've been incredibly impressed by the MGH response. It's been logical, it's been ready. Never have they been behind the eight ball. And even in terms of opening up Boston and Massachusetts, I think they take the political leadership's input and they send an organized and consistent message. So I think
Okay.
it's been great.
Okay. And did the MGH still suffer from lack of beds and lack of respirators?
So what we were stressed for it, yes. And so what Mass General did, like a lot of major institutions, is they took all the ventilators that are in the operating room, and there are a few hundred there's about 120 operating rooms. They took those ventilators and converted them into ICU ventilators for patients who required intubation and ventilation due to COVID. That actually also limited our ability to do elective surgery. We could only do emergencies because there were only a select operating rooms available. And I think they also screened everybody. So you assumed if patients had not been tested for COVID and they came into the hospital emergently or urgently, we assumed that they all had COVID. So we had personal protection equipment, and we were ready. Every patient we assumed had COVID that we operated on emergently. So they also participated in this effort to re-sterilize the N95s and the masks. There is a facility out in Somerville, and it is a hydrogen peroxide sterilization, and MGH was part of the initial efforts and waves to re-sterilize PPE, which has been great. They've also had a very restrictive and limited policy towards outsiders. So patients that are in the hospital cannot have visitors. No families can accompany patients, and physicians, nurses, first responders, everybody in the hospital has to take a survey the night before or the day of entering the hospital to assure that they have no symptoms of COVID. They verify that, they attest that on the computer, they walk in showing their badge and their clearance for entering into the hospital. And what they've done is they've provided iPads for patients who want to be in touch with their families and communicated with them, and it's been challenging to talk to families. It's been really hard, but not as hard as it is for the patients to be alone and suffer and sometimes even die from this.
Mm-hmm. Now, would you say that you've been working more or less or equal than regularly?
I would say that our department and division of vascular surgery response has been to take anyone who is at high risk for COVID. That means physicians and healthcare workers who are over the age of 60
Mm-hmm.
or who have comorbidities that place them at high risk, whether it's pregnancy, diabetes, or other problems. And they have been sent to either work at home with remote access or in less threatening environments. So that the burden has fallen on people or physicians and nurses and trainees to then be scattered throughout the system and go where the help is needed. So in vascular surgery, there have been about 4 to 6 of us who have taken call a week at a time so that we can limit exposures to the rest of our partners. And so we have one person who's 24 on for 7 days, who's taking all the calls for all the emergencies, and that way other people can either quarantine if they need to or be protected. The other thing that we have done is we've participated actively in an ICU team. We're vascular surgeons, we operate on blood vessels, so we can put special IVs in the arteries and the veins and tubings that other specialists can't do. So we've been part of this ICU SWAT team, or this, we call it COBRA. So we basically have a team of trainees, so vascular and surgical residents and fellows, and also the faculty, and it's 24 on for a couple of days. And what we do is we go to all the COVID patients and we change out their special IVs, their central lines, their arterial lines, their nasogastric tubes. And by having consistent care, we're able to minimize the risks to the patients, and it's been very helpful in the ICUs.
Okay, thank you for your time.
Thank you, Andrew Eagleton.